Welcome to Pathfinders for Autism Zoomcast. I'm your host, Rob Long, and today we have a very special guest. Today's guest is Dr. Li-Ching Lee, who's the senior scientist at Johns Hopkins Bloomberg School of Public Health. How are you, Dr. Lee?
I'm good. How about you? Thank you.
I'm doing well. Thank you so much for your time today to join us on our Zoomcast. First, could you tell our viewers all about what you're doing over there at Hopkins at the Bloomberg School of Public Health?
Sure, absolutely. And thank you for having me. So we are doing the ADDM network. So what is the ADDM network? It's the Autism and Developmental Disability Monitoring Network. So what we do is we try to monitor, it's a public health surveillance, try to monitor the trend or the changes of autism spectrum disorder in our community. So the ADDM network is funded by the CDC to determine the prevalence of ASD across the US at the different communities. So that way we can provide a comparable and population-based estimate of the prevalence rate.
And we're so very happy that you all are doing consistent work and constant work on that. We've learned about the ADDM that you're working with. First of all, what does that stand for? And what is the Maryland project doing for the ADDM?
Sure. So that stands for Autism and Developmental Disability Monitoring. So that is a public health surveillance system. We tried.
Now, the most recent prevalent rates for the CDC estimates that nationally 1 out of 54 children have been identified with autistic spectrum disorder, which we call ASD. How do the numbers change in the last study?
Sure. So right now, this year, we report 1 in 54. So that is slightly, when we talk to the rate, it seems like a slightly increase from the previous year. But I want to comment about how do we interpret these numbers, right? Overall, across the U.S. community that participate in the ADDM network, the prevalence increases as compared to the last time when we report. That is, so there is an increase.
Yeah, I mean, and it's increased a lot as well. I know it used to be, it was more prevalent with boys than girls, but the prevalence rate lately for autism in Maryland has changed in the other direction. The number has gone from 1 out of 134 to 1 out of 128 in Maryland. What can we attribute to that?
So please allow me to talk about one thing about the ADDM network is that the great things about ADDM, we implement the same protocol, same methodology, same criteria across the US community. But as compared to the one published in 2018, we actually used the previous diagnosis criteria we call DSM-4, versus now we use a newer set of criteria, the DSM-5. So it seems like the overall across the board, that if we use the new criteria, the prevalence rate can drop slightly. So that sometimes we also want to keep that in mind, that there's a different criteria set there too. So now come to your question is about the differences, right, for the males and female. It seems like we are still consistent with all the literature and across the globe. Most the literature would agree that the boys to girl ratio is roughly around 4 to 5. So we are still in the ballpark and consistent on that.
Now, in Maryland, I guess we're talking about the difference between males and females, the prevalence rate. But in Maryland, is there a difference in the prevalence rate among Black, white, and Hispanic communities?
As of right now, the current report, we actually don't see the statistically significant difference in the different race and ethnicity group. So that is actually a good news for our community, meaning that the disparity disappearing, because in the previous surveillance year, we did see that the race that being identified is higher in non-Hispanic or white as compared to Black and other minority group. So now we don't see that difference across race and ethnicity in Maryland. So that's good news.
That's great news. That's great news. And to be honest with you, I think that's a large part of Maryland being so much on the forefront of things and kind of being ahead of the curve on a lot of people. There are other studies from the CDC that show that the prevalence rate has a much higher number. What is the difference between the study and other studies that show different prevalence rates?
Sure. I think you refer to the two national surveys. One is the National Survey of Children's Health, and the other one is the National Health Interview Surveys. So these two are U.S. national representative surveys. And the methodologies that implemented in these two surveys is very different from other. So in these two national surveys, they asked the parents or the caregiver, the parent say, if a doctor or healthcare providers ever told you that your child has an ASD, and the age range is actually for the children's age is 83 to 17. So we see the two differences here. In ADDM, we actually is a record-based. There's a record-based surveillance where we not only just take the community professional who already make the diagnosis. So ADDM's expert clinician also by reviewing the records, they can also determine the diagnosis which may not be picked up by community professionals, or the kids never have the opportunity to seek health care to get the diagnosis. So that's one. ADDM's diagnosis are validated. And the national survey is reported by parents. So it can go either way. It can be like parents over-reported or parents under-reported as compared to the other one. And also the age group is different. So in ADDM, we only have 8 years old. We report 8 years old surveillance versus 3 to 17 was age range for the both national surveys. So that can be, the difference can be due to the methodology.
Dr. Lee, how long have you been involved in autism research?
I have been starting full-time working on the autism research since 2003.
2003, so you're talking just under 20 years. And I know for myself, that was about the time my son was diagnosed with autism, and I've seen a lot of growth in the field. How much has it changed from the time that you started in 03 to today, 2020?
Oh, that's a huge change. I have to say my personal experience. So for example, in the field of research, which I'm a researcher, I'm a scientist. So you can see the research funding pulled it in that really promote a lot of research. So for us as a whole, as a community, to get more understanding about what is autism. Our general community, the parents' work group, parents' advocate group, like a Pathfinder, and also the governmental agencies or organizations, putting so much effort to increase our awareness and understanding about what is autism. And that as a whole really promote more available services to families, to children who are in need of ASD-related services. So I think there's a huge changes in our society, in our community, in our school system, and in our healthcare provider. So now that more services become available, and we were able to get the research going, and we are having this ADDM network to be able to provide and monitoring the changes of this, the occurrences of autism. And
Do you think we know more about autistic spectrum disorder today than we did 15, 20 years ago?
Okay, that's a really great question. although we still don't know what causes autism, and we don't know where is the cure for autism. However, I'm extremely optimistic because every day we are one step closer to find out my answer, what causes autism. And once we know the causes, that would definitely help us for how to cure or how to, it's just like increasing our understanding every day. We can do more, and we can do it more individualized. We will know what we are facing and how our family facing. And absolutely big advance has been making since I joined this field, joined the Johns Hopkins University for Autism Research in 2003. And that all to, I think the society owe to a great debt of gratitude to the parents' advocate group, parents' group. It's a big community. We do this together.
It is, and trust me, as a parent with a son on the spectrum, I thank you so much for all the hard work that you put in. And also, I'm very thankful with the hard work that Pathfinder for Autism does. What kind of benefits do you think organizations like Pathfinder for Autism bring to Maryland autism community?
I actually think we are very fortunate to have Pathfinder in our community. And to me, when the parents got some parents actually knew none of the autism after their child was being diagnosed with it. So I always find that Pathfinder, parents organization like Pathfinder, is such a great trusted source of information for parents. And they have, starting from the beginning about what should you do when you first get diagnosis. Okay, so here is what you should do. What is the treatment available? Here is the treatment available. And what can we do? And also increase the awareness. Everywhere you go, the event, you can see Pathfinder's desk there with the community, with the parents. That just make a huge difference. If I were the parent, I knowing that I always have a trusted source of information going there, I know I can find the information there. If for example, the COVID-19 now is a big deal in our society that have such impact for all the families. And I can always go there, try to find parents. If you have a question, you can go there. Pathfinder is an expert on COVID-19, but they can provide a trusted source of information. Okay, go here, come here. So that itself is a big deal. And on top of that, Pathfinder also disseminated the information to not only just the parents, teachers, the health provider, policymaker. And I'm most impressed about, they also provide a workshop for police officer, law enforcement. And that is really huge. That really bringing everybody together, like, okay, let's getting more understanding. I know we are a vast majority of us. We want to do good for our society, for this family. We want to help. Right. But sometimes it's a misunderstanding. So that become a barrier for us. By putting all this, everybody together, I just felt like it felt like there is always somewhere you can go, and that support me if I was for parents, for researcher, for law enforcement, for the police officer, for healthcare provider. That is just incredible.
Absolutely. Dr. Li-Ching Lee, Senior Scientist for Johns Hopkins Bloomberg School of Public Health. Once again, we thank you so much for all that you do for our community, and thank you for your time for joining us on the PFA Zoomcast. Thank you very much.